Good morning, everyone, and thanks for connecting with us. We have Michele Laflamme with us. She is a patient care technician at UPMC in Erie. That's the UPMC Hamot office and University of Pittsburgh Medical Center. Let me back up. My name's Nick. Maybe you've seen me before, maybe not, but I work with the Northwest Tri-County Intermediate Unit, and we wouldn't be able to connect with professionals like we're connecting today if it wasn't for our partnership with the Northwest PA Job Connect, which is our local workforce development board. So a special thank you to them for establishing that connection. And without further ado, we're going to send Michele live. But I want to point out that somewhere on your screen, there's like a conversation bubble with a question mark in it. And feel free to ask Michele any questions as she's talking. So what we'll do is we're going to ask Michele some simple questions, and she's going to talk about that stuff. And then we're going to shift over to those questions towards the latter part. But Michele has a lot of great experience, a lot of things related to the profession, and we want to hear from her. So we're going to send you live. And Michele, thank you for joining us today. We know you're very busy.
Thanks.
So could you tell us a little bit about your title, patient care technician, and a little bit about what you're doing?
I am. I'm at UPMC Hamot. I've been here for 12 years. The second year I started here, I actually became a lead aide. I do a lot of educational pieces like today. I also do training. Any aide that comes through UPMC Hamot, I'm asked to teach. Right now, I'm actually teaching the COVID floor. I've been an aide for 34 years. I actually worked in critical care at a nursing home for quite a while before I came here. It's just a great team. I love being here. I love what I'm doing.
That's awesome. Tell us about specifically, what is a patient care technician? What's their role? What's the responsibility?
Your responsibility is to make sure that the patients are safe, well taken care of, communicate with them, obviously get them better, bathe them, dress them, make sure they've got something to eat 3 times a day, make sure they're walking, make sure their physical therapy and occupational therapy has been done throughout the day. Just making sure you're on hands at all times taking care of your patient, getting them better so we can actually see them discharged from here.
Yeah, so your primary function is the patient. You've been there for 12 years. So as the lead patient care technician, you're working with new hires and you're bringing them. Is that what you do a lot?
I work with the new people that come in. I teach them, our hall and what you do and what an aide does. I also have 3 other aides down the hall. My responsibility is to make sure that everything gets done throughout the day. The baths, the feeding, the turn and positioning, the walking, everything that's critical to get a patient better and get them out of here.
Yeah. That's very, very, very admirable, and that takes a special type of person to do that. So why don't you tell us a little bit about, like, if somebody was interested in working in medicine or even as a patient care technician, what interests or abilities would you say that you have that makes you, great for what you do?
I would say compassionate, time. You have to take your time with these patients. You have to listen to them. Let them verbalize what they want. Don't overspeak over them. Be a hard worker, because it is a very hard job. I mean, what we do, you're with the patient 24/7 in and out of the rooms. It's not like a nurse giving meds and then you're leaving. You're actually in and out of the room constantly all day long. Now, so I would say comparing compassionate, hard worker, dedicated, really wanting the job and really giving it your all, because they definitely deserve that when you're here.
Yeah, and that's a huge responsibility, especially whenever you said you're on the COVID floor right now. So tell us a little bit about what UPMC Hamot has done with like intensive care floors and how they've added floors. Talk to us a little bit about what UPMC has done to our pandemic.
I can pretty much speak for our floor. Our floor was actually a 24-hour observation floor, but now we are a COVID floor. So what they did is they took some of our rooms and made them into pods. So we're an airtight hall now. So when you come in and out, you have to make sure that you have your shield on, your gown on, your gloves on, your mask on. There's a lot to prepare. It takes you about 10-15 minutes to get prepared to actually go through the double doors to get into our COVID floor. I just want to reiterate, people need to wear their masks when they're out. They need to wash their hands when they're out. This is real. People think it's false. It is very real. These people are very sick, and we need to, you know, do our part and to try not to spread it even more. So yes, they're very sick people.
Yeah, and this is just the floor on which you're working is just one floor, and you said that's airtight, so that means that, you know, when you enter that for a shift, you're not. Are you allowed to leave, or do you stay there?
No. That's why I'm hydrating right now, because you can't have no water bottles in there. You can't eat in there. You can't take your mask or your shield off. You cannot go to the bathroom in there. So we do 2 hours on, 2 hours off. When you're off, you're actually a runner. So if anybody in the COVID hall needs anything, then you're the runner going and getting it and making sure that they have what they need. So you're 2 hours in, you're 2 hours out. So when you're out, you're a runner. When you're in, you're actually an aide paired up with another aide, and there's nurses that are paired up too. So like today, I have 8 patients. I'm paired up with another aide. So I go in for 2 hours. She stays out for 2 hours. She's my runner. So then we switch. I come out, she goes in. Yeah, okay. So there's no bathroom. You got to make sure you use the bathroom before you go in, and you got to mainly be hydrated. That's the key thing that people are having issues with, because when you put the mask and the shield on, it's airtight. So you feel like you're getting dried out a lot. So drink. Yeah, even at home, I'm drinking a lot more water.
Wow. So that's specific to COVID, and you've moved entirely to the COVID floor. So have you, tell us a little bit about, have you worked your previous work? You said you worked at a retirement home.
Yeah, I did critical care in a retirement home. Them people on my floor were actually there, and they were going to pass away. That's the floor that I worked on. So I have a lot of background in critical care to begin with. Yeah.
Okay. So I want to shout out to our attendees that are on there that if you have any questions for Michele as she's talking, you can feel free to type those into the question and answer component, and we'll get to those towards the end. But Michele, I'm sorry, I interrupted you. You were saying?
The unit that I worked at in the nursing home, that was more like vents, trachs, feeding tubes, respirators, all that kind of stuff. So, yeah. And that's what really brought, if I wouldn't have got married, I'd probably still be there, but I wouldn't tell Hamot that right now. But yeah, I love my job there too, but I love being here at Hamot. I mean, they treat you very well. It's a good organization to get into. It's definitely career life for me. I will retire from Hamot. I won't be going anywhere else. Even not working the COVID floor, I can truly say I love my job here. I love Hamot.
So has Hamot, we've always heard positive things about Hamot and UPMC. Has Hamot, and you said they have additional floors that they've adapted for the COVID pandemic.
Yes.
Approximately how many patients are you guys working with right now that are positive?
50, 60, 70. We probably got around 80-some patients right now that have COVID here in our hospital.
And you were talking about you have somebody, one of your 8 patients today that potentially could be discharged.
Yes.
Walk us through that process of how somebody gets discharged with COVID.
Well, this is going to be my first experience actually discharging somebody. So I'm not really even too sure about that. I do know that she's going to be discharged today. She was very ill when she came in. We actually got her better, and she gets to go home. And I'm pretty sure that she'll mask up as she goes down through the hallway, and we'll get her completely out to the front. So her family will come up to the front of the hospital, and we actually take her down through. because we want to make sure
Great.
everything's safe. So nobody in the elevator, when we go down, that elevator will be cleaned when she actually gets out to be able to reuse it again. So everything is sterilely clean once they leave. Everything's bleached down. Yeah.
Okay. So let's shift gears a little bit, talking specifically about a patient care technician, and even shifting gears into you as a lead patient care technician. What are essential skills that you have to have?
The
can
skills,
talk a little bit about
the skills that I had to go through, telemetry. So that is heart monitors. I had to go through an EKG class, which is knowing heart rhythms. So if somebody goes into stress, I can actually read the rhythms. Phlebotomy, I can actually draw labs. Foley catheters, which are the urine bags that they wear. I can insert them and take them out. So there's a lot of educational classes that you have to go through, and there is tests at the end of them to make sure that you pass in order to be a lead aid. But here we have like PCT1, PCT2, PCT3, then we have an advanced PCT, and then you have lead PCT. So there's chains that you go up through, and there's a lot of educational classes you have to take before you get there.
That's great. So let's talk about those hard skills. Do you spend a lot of your time do you have to do things on a computer? Do you have to what are mostly the hard skills that you have to learn?
Computer is one, yeah. Learning how to bathe somebody, learning how to feed somebody, knowing how to put a heart monitor on, knowing how to do vitals, knowing how to feed somebody, knowing how to give a shower to somebody, knowing how to do physical therapy, which we have therapy people that come in and actually guide us and show us how to do patients that need to get up and walk. They'll actually come down and educate us and show us how to do it, because sometimes you might use a walker, sometimes you might use a walker and a gait belt. Sometimes we have paraplegics where you need to use a Hoyer lift, which is a lift that gets them completely out of bed with a sling, and learn how to maneuver them that way. I mean, a lot of education.
And you're dealing with patients that are there for a reason. They're ill or they're working to get better. So let's talk about those soft skills. You touched on that a little bit about compassion. What kind of speaking and listening, and tell us about what makes you an exemplary patient care technician.
I give 100%. When I'm here, my dedication is to each one of my patients. Just listening to them. Sometimes they don't want to be here and you have to redirect them. We do have combative patients. You just have to know how to work with them and try to calm them down and, let them speak. Mainly, usually if somebody's combative, it's because they're saying we're not listening to them. Be quiet and let them talk. Sometimes it's just 5 minutes of letting them vent because they don't want to be here. Yeah. So yeah, you just got to be compassionate. I definitely got the heart and the drive to do it. I love teaching. I love seeing success stories of the people that I've taught. I have nurses here that I taught as an aide that are now nurses working my floor. So it's great to see them, expand.
Yeah. You have to have those strong people skills and be compassionate. That seems like a top priority. So let's talk a little bit about your education. You mentioned what kind of education does UPMC Hamot require for somebody to come in at a PCT1 or Patient Care Technician 1?
I know you have to have a high school diploma or a GED. They like you to have like a first aid class or something like that. It's not you don't have to have it, because a lot of your training is when you come in. I'm the one teaching all that. So you get a lot of training when you come in. So if you have a high school diploma and this is the field that you want to get into, some kind of nursing career, a career of long-term taking care of somebody, this is where you need to be.
And you're always going to, from the sounds of it, required to grow and to learn. So you have to have an open mind and a drive to better yourself. Is that
yes? Yeah, a lot of people ask, well, I'm 54 years old and I'm proud of it. And everybody asks, why are you not a nurse? I don't want to go into nursing. I had that opportunity. Hamot really wanted me to go that route, and I said no. My dedication is as an aide to my patients. I mean, I've worked my way up the ladder. I can't go no farther, and teaching is my goal. That was my goal when I started here, and I met my goal, and I'm doing it, and I'm happy what I'm doing. So this is where I will retire.
Can you differentiate for us what the difference between a nurse and a patient care technician?
Yeah, a nurse is pretty much giving your medications, anything like that. Sometimes they'll come in and draw labs too, but that's pretty much what they're doing. They're doing medications. Medications, gotcha. Yeah. So in order to become a PCT or patient care technician level 2 or 3, you said there's courses you have to take and tests you have to pass. Can you talk a little bit about that? Like I said, one is an EKG class. That's where you learn how to do EKGs, learning how to put the monitors on, knowing how to read the strips. Another one is phlebotomy, where you're actually learning how to draw labs. There's just a lot of things. You learn how to, like I said, the Hoyer lifts, any kind of lift, any kind of physical therapy. There's just a lot to learn. Yeah. And the more you learn,
I'm going to throw it out there.
Yeah, go ahead.
No, you go ahead. The more you learn.
The more you learn, and the more classes you take, the higher up you'll go. But the classes that you take aren't just like going in and learning it and taking the test. I mean, they really want to know that you got what they're saying. So like I had to go, like when I learned how to do labs, I had to go with a phlebotomist for a couple weeks and really show them that I knew what I was doing before they would let me come back to the floor and do labs. So yeah, they're really making sure you know, instead of just going and passing a test and saying, oh, now I can do it. It's not that easy.
Yeah. The hands-on application of it, they want to be able to see it.
Right.
Yeah. So let me shout out to our participants. We're going to be shifting gears here in a second to question and answer. But one last question for you, Michele. So participants, throw those questions in there if you have anything for Michele. Michele, tell us something fun. Tell us something interesting that you maybe experienced while you were working. Something like, wow, that was really, really great, or something funny. Anything?
So we had this 92-year-old lady, and she wouldn't eat for us, nothing. And I went in and I asked her, I said, if there's one thing that you want, what would it be? And she said she wanted a banana split. Well, obviously Hamot doesn't have banana splits. So we took a container that you usually spit when you brush your teeth, and it's shaped like a kidney bean. So we went down to the gift shop and we got a banana, and we called the kitchen and we got ice cream, and I went down to the cafe and I got syrup and strawberries and whipped cream, and we made a banana split and we took it in, and this lady cried because she couldn't believe that we took the time and effort to make her a banana split. That's not the end of the story though. So she ate the banana split knowing she was lactose intolerant. So after she ate it, 30 minutes later, she rang her bell and she says, now you need to clean me up. Because if you know when somebody's lactose intolerant, it's going right through them. So that was a good story. But she got her banana split and it made her happy. So that's all it meant to me.
That's all.
Making her happy.
And that's the compassion and dedication that you need to serve and work as a patient care technician. Yep.
Yeah.
So
I have another story if you want to hear it.
Yeah.
So we had a lady that was just diagnosed full-blown cancer. There was no survival for her, and she knew that. She had an aide the shift before me that I guess was really nasty to her, and I came in on my shift and she was crying, and I asked her, I said, what's wrong? And she said, the aide kept yelling at me every time I had to go to the bathroom. And I said, well, why? And she said, well, I have to go to the bathroom now. So we got her up and took her to the bathroom, and she messed the whole way to the bathroom. And she said, this is why the aide was so mad at me, because she had to keep cleaning it up. And I'm sorry, but you don't do that. She could, number one, she was, already going to pass away. She was just told that. Number two, she couldn't help what she was doing because she had pancreatic cancer. So she couldn't help that she was incontinent. I just took a lot of time with her that day and made her feel comfortable and cleaned her up every time with compassion and told her not to worry about it and that I was here for her and I was dedicated to her for a whole 12-hour shift. And she actually wrote a letter to our CEO here at the hospital, and I got it an above and beyond award because of my dedication to her.
That's very admirable, Michele. That takes a special person. It really does.
Yeah.
It really does. So we have some questions coming in.
Sure.
You mentioned the rotation of 2 hours on and 2 hours off in the COVID floor. So how long is your typical workday?
12-hour shifts.
And how many days of a week do you work 12 hours?
I'm dedicated to 3 12-hour shifts, but I'll tell you right now with COVID, my phone doesn't stop and I'm here a lot more than the three 12-hour shifts. It just depends.
Okay.
Right now, there's people that don't want to come in on the COVID floor, so we pull them to other floors. We actually could volunteer if we wanted to come to the COVID floor or not. Me, myself, I volunteered to do it. This is where I felt like I needed to be. So.
Wow. So if you had the ballpark on average, roughly how many hours a week are you working?
Maybe 80 hours.
Wow.
Oh, every 2 weeks. I'm sorry, that's every 2 weeks.
Okay, so about a 40-hour week.
Yeah.
Somewhere.
Sometimes more than that. It just depends.
Okay.
Like when you pick up on the COVID floor, it doesn't mean you have to pick up a whole 12-hour shift. I'd be happy just with 4 hours, 8 hours. If you want to do 12 hours, that's great.
So you mentioned that your phone's always ringing. So if you work your 12-hour shift and you said your phone's ringing, are they asking you to come back in, and why? Yes. Or for what reason?
Yeah, to come back in. As you know, right now we have a lot of COVID patients, so it takes more staff to run a COVID floor. So we need more people that are dedicated to that. So, yeah.
Would you say there's a demand right now for patient care technicians?
There is a big demand. Yes.
Okay. So that's,
I think if you want to be a nurse, if you're thinking about going nursing, I would suggest that you become a PCT or an aide or a CNA first before you be a nurse, because that way then you get the on hands of really knowing what you're getting yourself into.
Does Hamot offer any form of tuition reimbursement for?
They do. Yes, they do. And I think it's 80% right now. I'm not too sure. I don't want to really dedicate myself to that, but yes, they do.
Okay, so somebody could come right out of high school, work as a patient care technician as a level 1, and yes. UPMC they could go to school and UPMC would pay a portion of that, if not.
Yes, while they're working here, they could actually go to school and become a nurse, and Hamot does provide, and they have a lot of scholarships too that you can try to get yourself into. Yeah.
Right, so you can make money while you're going to school. And you said you've had some patient care technicians do that. Yes,
I have a lot of them that do that.
Yeah, so that's advice for you attendees out there. If you're thinking about the medical field, why go into that mega student debt?
Mm-hmm.
So there's organizations that'll
I'm pretty sure you have to dedicate yourself here for, I think it's like 2 years. You have to sign a contract in order to get that money, but it's so worth it. I'm telling you, this is a big corporation and they're phenomenal with us. I mean, they're thriving on getting you educated and moving up the ladder.
Yeah, that's what
when I started here, my second year, I had a lady named Muffy Mascaro. She was my boss. I actually did the float pool for the first 7 years I was here. The float pool is where you come in, you look at a board, and it tells you where you're going in the hospital. So I've worked every unit in this hospital. So to me, that was a good experience for me to start that way. That way I've learned everything. If I'm pulled to another floor, I already know it. But she seen good in me and she wanted me to thrive and become a lead aide. So my second year here, I became a lead aide. I went through all the classes, got myself educated, and did it.
Wow.
Yeah.
Wow, you climbed that fast. Good for you.
I did.
It's awesome. So one of the questions we have in our question and answer, and for anybody else out there, you guys can ask Michele any questions. What advice would you provide for a high school student that's getting ready to graduate this spring?
As far as
Any advice, whether it
coming
be
to the nursing field?
Sure, it could be about life, it could be about your career path.
I think you need to get into a career that you're going to be happy and stable with. I don't believe in job hopping. I think if you're really dedicated and you know where you want to go for your dream. Actually go straight to it. Don't stop, and don't let anybody tell you you can't do it, because you can.
That's great. That's great. Were there any classes or anything in high school while you were growing up that you took that helped prepare you for where you are now? Would you recommend that to anybody?
I would say maybe home ec, chemistry, math, algebra, any of that kind of stuff. You use a lot of math here. Typing 1, typing 2, because you're on the computer a lot. Any computer classes would be great.
So talk to us a little bit about the computer skills that you have to have. Like how much of your day of your 12-hour shift do you spend on a computer?
Anytime you're in and out of a patient's room, you get on the computer and you chart what you've done. So you are on the computer a lot during the day.
Now, are you charting inside that patient's room, or you come out and chart?
Outside. You can't chart in their room. We can't take the computers in there.
Oh, okay. So
Yeah.
Each time you're having an interaction with a patient, you're recording that on a computer.
I am. Sometimes I might not go right then and there. So I have a book, like a little pamphlet that I take, and I can write down what I've all done, and then I can go back and chart, because you can always change the time on the computer of what time you did it. So I can always go back and chart. So if I'm completely busy throughout the day, I can always go back and chart.
That's a good professional tip right there. Yeah, that's a good tip. So Michele, I want to respect your time, because there are patients out there that need you right now a lot more than we need you. Are there any parting words you'd like to share with us or with the audience?
I just think if you live here in Erie or close by, come see us, come get a job here at Hamot. We'd be more than glad to have you. Education is the key word. Get that education and, graduate from high school. Follow your dreams, because you definitely can be successful.
That's great, Michele. Thanks. So without further ado, I'm going to say a special shout out to all of our attendees today for connecting with us to talk with Michele. Very admirable position, certainly in high demand. So if you have any desire to go into the medical field right out of high school, have to have that high school diploma, you can go to work right as a patient care technician. This session is recorded, and we're going to be posting it on our website soon. But I want to say thanks to Michele, and thanks to all of our attendees for connecting.